My name is Lena. I am a pharmacist.
My name is Tolu. I am a second degree nursing student at the University of Calgary.
Kyle, I am currently a final year fellow, and then 2 years ago moved to Calgary for my fellowship in pediatric hematology and oncology.
I'm an optometrist, an internationally trained optometrist.
So I've been working as a general internist for about 8 years now. I work primarily at the Foothills Hospital, but with my interest in medical education, I spend about 60% of my time actually doing education work and about 40% of my time doing direct patient care and clinical work.
A typical day in the life of a nurse, and how does it vary across different nursing specialties?
It definitely varies between disciplines, I would say, or the unit you work in. So in nursing, you typically work on a unit. So you're either on an internal medicine unit, a general medicine unit, an intensive care unit. And then every kind of unit you work on, it depends on what that unit has, and that would influence or the kind of patient population that goes into that unit, and then that would influence the kind of nursing work you do. So a day in an ER, I start out triaging patients that are coming into our waiting room, and that requires me to have really good assessment skills, knowing the right questions to ask, and being able to figure out who needs to go to the trauma bed or any of the beds as soon as possible. So that would mean I not only have to ask the right questions, but if the patient is so disoriented that they can't talk, I need to also be able to figure out just from looking at them what might be going on, and then send them to the back.
Can you share a significant challenge you've experienced in your medical career?
Challenge that's come up was the COVID pandemic. And so that was, I think, a very challenging time for everybody who works in healthcare. It was very stressful at the beginning when we didn't know anything about the virus. And then as patients started to present to hospital and be admitted with complications of COVID infections, it was sort of learning as we go what the right treatments were, worrying about the health of our patients, seeing a lot of negative outcomes, and then also worrying about our own health at the same time. And so it was definitely a challenging time. And I think some of the things that really helped myself at least get through that period of time was kind of realizing that all of my colleagues were in this with me, and that we weren't alone in fighting this, and that we had each other, and that was a very amazing resource to lean on.
What steps should aspiring pharmacists take now to prepare for a career in pharmacy?
Generally, from my understanding, is most schools will require a couple semesters of general biology, a couple semesters of general chemistry, organic chemistry, English, math, statistics, that kind of stuff. That's what I remember requiring. They've revamped the program a little bit since I went through it, and they've required a little bit, I think they require anatomy and physiology now, which they never did before. In terms of other things to kind of prepare you and to look into, I think like shadowing pharmacists is really useful to kind of get a sense of what the career is actually like. Community pharmacy, hospital pharmacy, kind of like dipping your feet in both areas to see the different practices of both, because they are both very different. And
how do you balance work and your personal life, and what strategies have helped you maintain that balance?
As an optometrist, it's actually quite easy. Yeah, I have my patients booked every day, so I know how many patients I'm going to be seeing, and I usually know what's wrong, because there's like an intake form, like, oh, this is what's wrong with me, and all of that. So it affords me amazing work-life balance, this career. And so
can you shed light on the difficulty of medical school, or the schooling for your career?
So nursing school is a lot of work, primarily because you have to still stay on top of your grades while going to clinical. And personally, I'm so tired after clinical. So like clinical is when you go to the hospital and you're working as a nurse for a set number of hours. And after that, I just come home and I can't do anything. So that means that I pretty much have 2 or 3 days in a week where I am useless in terms of schoolwork. I just focus on hospital clinical work. And that means I need to spend the remaining 4 days of the week really trying to stay on top of my grades and on top of my assignments and stuff. So that is definitely a challenge, but I feel like I welcome it because it teaches me a lot of time management. Like I kind of feel like every single minute is precious to me. So I have to make sure that I'm, organized, and no time for procrastination, because you can't be writing 5 papers in one weekend.
That like kind of lifelong learning is a big aspect of all of our specialties. And that lack of exam after everything is done, I would say even starts earlier. Most medical schools now are pass-fail exams. So you're studying not to get a passing grade or a good grade, like the focus is so much in, high school and undergrad, but you're studying to actually know the material. So you know what you need to know later on. And it becomes less about competing for those good grades or those spots with marks, but rather with your experience and your interest and your exposure.
Do you have any, words of advice, things that have really stuck to you throughout your whole experience?
To be open to try new things and don't rule anything out too early on. When I was in high school, I honestly could not have imagined myself being a pharmacist. I knew I wanted to work in the healthcare field, but I didn't exactly know what that looked like for me. And so I shadowed a bunch of different healthcare providers, and this allowed me to get some good insight into the roles that each kind of profession takes on. And it allowed me to figure out what profession fit me, my goals, and the picture in my life that I wanted.
I'm a very realistic person, and I think it's important for me to say that no matter what happens in the future, you're not a failure, and there's so much you can do with your life. I personally came into nursing really late, and I came into healthcare semi-late because I actually wanted to be a botanist, and I didn't have any passion for healthcare. It was, for me, I started to gain this passion in 2016 when I was reading some articles about the war in Syria, and I really wanted to go and help. And I felt like, how can I help in Syria? And I was like, they need doctors and they need nurses and they don't need engineers right now. I was an engineer at the time before I switched over to psychology. So just keeping an open mind that there's so many things you could do in this life.
From my perspective as a physician, and from hearing from lots of undergrad students who are working towards getting into medical school, I think there can be a real tunnel vision that happens about, this is what I wanted to do forever, or maybe this is what my family does, or this is what's expected of me, or those types of things. But there is a million different paths that you can take, whether that brings you to where you thought you would be at the start or not. I think just really following what you think is best for yourself, and having some grace to know that if plan A doesn't work out, plan B or C or even D will likely fulfill you at the end of the day just as much as your initial plan would.
Me, I would say find your passion and stick to it. Don't give up. Don't give up. Work hard towards it. Don't be afraid to try new things. If you feel like something is not working for you, it doesn't mean that you're a failure, Just try new things. Don't be afraid. You're doing great. Find your passion, stick to it. I say that I keep repeating this because in school you see so many people leave the course, fail out of the course, not because they're failures, they're just better at other things, so that's why I say don't be afraid to try new things, find your passion, work hard towards it, stick to it, find mentors, shadow people in different occupations, find what you're good at and what you enjoy, and the sky is not even the limit at all.
Perfection is an illusion, and it's really easy to look around and feel like everybody else has it all together, and maybe everybody else is more deserving of a position or a role or something that you actually really want to go after, and they're not. And so I think instead of trying to justify why other people are more deserving of a career or a job that you think you would like, just think, why not me? Like, why can't I do that? And I know people get worried about the competitiveness of entry into fields like medicine and the acceptance process, but if you count yourself out before you even try, you'll never know if you could have done it. And I know so many amazing doctors who applied multiple times and didn't get in before they finally did get in. And if you know that it's something that you really want to do, it takes hard work, and there's going to be so many failures along the way, but it's very worth it at the end.